Mwiriwe, bon après-midi. We are getting ready to start our graduation, so please rise as we welcome our special guests, faculty, and graduates. be seated. Once again, good afternoon, bon après-midi, Ngiriwe. My name is Gloria Igihozo. I'm a lecturer in the master's program at UGHE, and I will be a master of ceremony for this special occasion. Thank you for joining us for this year's graduation ceremony to celebrate our 2023 Master of Science in Global Health Delivery class. I would like to welcome our distinguished guests and dignitaries who have joined us on this momentous occasion in Kigali and online. Honorable Minister of Health, Dr. Sabin Nsanzimana, Honorable Minister of Education, Dr. Valentine Uwamaria, our commencement speaker, Dr. Joya Mukherjee, the UGHE Vice Chancellor, Dr. Mubiligi, the Dean of the School of Medicine, Professor Abebe Bekele, the Dean of Research, Innovation, and Quality, Dr. Tomlin Paul, Governor of the Northern Province, Nyirarugero Dansil, Mayor of Burera District, Uwanyirigira Marie Chantal, dignitaries of Burera District, faculty and staff of UGHE, distinguished guests, students, families, friends, and supporters of UGHE, and last but not least, our dearest graduates, the MGHD class of 2023, all protocols observed, welcome to this graduation. It is my privilege and honor to welcome you to UGHE's 8th cohort of Master of Science in Global Health Delivery degree granting ceremony. Please allow me to invite our Vice Chancellor, Dr. Joel Mubiligi, to give us opening remarks.
I think I'm tall enough. Honorable Minister of Health, Dr. Sabin Nsanzimana, board members of UGHE and Partners in Health, Dr. Joya Mukherjee, our keynote speaker for the 2023 graduation, UGHE faculty and staff, distinguished guests, donors, students, families, and friends, and our dear MGHD class of 2023, good afternoon. A very warm welcome to the 2023 graduation. I'm honored to be standing here today in front of such a distinguished crowd to celebrate and rejoice in the commencement of the 8th cohort of UGHE Masters of Science in Global Health Delivery. I would like to start by congratulating our graduates from 13 countries across the globe: Rwanda, Burundi, Canada, DRC, Ethiopia, Kenya, Liberia, Malawi, Nigeria, Syria, Uganda, USA, and Zimbabwe. Congratulations for your hard work and dedication. You have all accomplished so much in the last year, and I'm really, really proud of you. I know times have been rough, but it has also been immensely gratifying. By learning about some of the most important ongoing global health challenges, you now possess the skills and information required to truly impact the world. Our gratitude goes to the government of Rwanda and all our dear supporters, partners, and friends. You have been of great help and have made a real difference in the lives of our students and the community we serve. The challenges that the world faces today need more people who are open to unconventional thinking, who are committed to bringing creative solutions for the most vulnerable, and who are prepared to be trusted collaborators in addressing ongoing global health issues. This is why at UGHE, we strive to achieve health equity by training the next generation of healthcare providers and policymakers who will focus on the most vulnerable among us and bring equitable and high-quality healthcare to all. People like our co-founder, the late Dr. Paul Farmer, whose sense of community and critical thinking endure till now and was passed as a heritage that provides students with interpersonal, and management skills necessary to direct health systems towards sustainable healthcare services. UGHE has already solidified its position as a leading institution in global health education. In the past 2 years only, UGHE was granted several global and prestigious recognitions, including most recently being ranked 8th in the Times Higher Education ranking of Sub-Saharan African University, and 2nd in Impact in Africa category. These achievements are a testament that the hard work of UGHE community and its commitment to changing the way health services is delivered. Dear graduates, I encourage you to make a difference with your education as you walk out into the world. Make use of your ability to solve difficulties. Use your brilliant minds to become change agents, driving innovations and improving healthcare systems worldwide. Make use of your knowledge to help others. Use your enthusiasm to motivate others to join you in improving people's life. As you continue on your professional journey, remember that you carry the UGHE and Partners in Health spirit within you, a spirit of equity, innovation, and transformative leadership. Once again, welcome to everyone, especially our graduates, and may this graduation ceremony be a celebration of your accomplishment and a reminder of the incredible potential you hold to shape a more equitable and healthier future for all. And with this, let's our ceremony start. Thank you very much.
Thank you very much, Dr. Joel. Next, we will get to hear from student representatives from each of the 3 MGHD options. Our first student speaker is representing the One Health option, and her name is Ruth Zihiga Uwase. Ruth Zihiga Uwase is a dedicated public health advocate who channels her passion into finding innovative solutions for global health challenges. With impressive track record working with renowned organizations such as UNICEF and JPIGO, she utilizes data-driven approaches to improve the delivery of healthcare services. Currently an MGHD student in One Health, she strives to create sustainable solutions and holistic solutions to optimize the well-being of people, animals, and the environment. Ruth, welcome.
Good afternoon, everyone. Honorable Minister of Health, Honorable Minister of Education, the UGHE Vice Chancellor, the Dean of School of Medicine, the Dean of Research, Innovation, and Equity, our commencement speaker, faculty and staff of UGHE, distinguished guests, friends, and family, dear MGHD 2023 graduates, good afternoon. Today, we gather to celebrate our remarkable achievements and witness the birth of a new generation of global health leaders. This day marks the realization of dreams for many of us. This past year, we have all withered through countless sleepless nights and swerving deadlines and the infamous 1159 battle that all students know about. Despite these tough moments, however, we have laughed together, we have grown together, but most importantly, we have learned together. Whoever said learning new languages when you're an adult is difficult definitely never had a Latin expert in their class. The diversity of our cultures, backgrounds, and perspectives in our classes became a melting point of wisdom. Each student's unique viewpoint added depth to our discussions. It expanded our knowledge and challenged us to think beyond our preconceived limitations. I don't think anyone will forget the mid-class debates between Momo and Abdul that taught us more about Liberia and Nigeria than any textbook could ever teach. Throughout the program, one of the invaluable lessons we have learned as the One Health class is the interconnectedness of humans, animals, and the environment. As a class, we're very fortunate to spend 2 weeks immersed in the vibrant communities of Musanze, engaging in meaningful conversations, sharing life experiences, and learning about the critical aspects of life that shape their everyday lives. From visiting clinics, mining fields, national parks, meal collection centers, and learning from district and government officials on disease outbreak preparedness and prevention, being on field reminded us of our duty to strive for equitable health for all. We came to understand that from zoonotic diseases to the delicate balance of our ecosystems, the health of one affects the health of all. Therefore, it is not merely enough to acknowledge the disparities that exist in our communities, but we must actively work to dismantle these systems that perpetuate these inequalities. Throughout our education, we have been equipped with tools to break down barriers and to advocate for justice for all. All this could not have been possible without the remarkable support of our esteemed lecturers. Dr. Fedra, you have exemplified what it means to be a global health leader. We have savored every lecture and absorbed an abundance of knowledge from your expertise. You have nurtured within us the desire to be a part of the dream team. Dr. Yana, your teachings have transcended the confines of the curriculum, imparting invaluable lessons on personal branding and helping us discover our true passion within a vast sea of possibilities. Dr. Shaka, your unwavering commitment to the success of every student has been truly remarkable. You have provided words of wisdom and dedicated your time selflessly, enabling us to reach our fullest potential. Our OH class, DG Maria, your passionate advocacy on ecological emergencies and climate change has ignited a drive within us to effect change in our own communities. Professor Shani, the universally beloved and coolest class assistant, your presence has been an indispensable success to our program. Ms. Gloria, you have been an exceptional lecturer, inspiring us with your profound understanding of complex subjects. Your ability to navigate through challenging topics has left a lasting impact on all of us. Thank you all for sharing your invaluable knowledge with us and for making us feel seen and heard. I also extend our heartfelt appreciation to all the faculty, the visiting lecturers, and our fellow students in both the MGHD and MBBS programs who have supported us throughout this journey in the One Health field. Our profound gratitude also goes to the kitchen staff, the student services team, the security team, the IT team, and the health and hospitality team, who all made our stay in Butaro campus an unforgettable one. Equally important, thank you to our parents, guardians, friends, for standing with us through this journey. I cannot end without extending our deep appreciation to Partners in Health, the government of Rwanda, and all the sponsors in the MGHD program, whose commitment to education and health have enabled this opportunity for each one of us graduating today. And lastly, to my fellow MGHD graduates. Today, as we stand on the cusp of a new chapter, I want to urge us all to remain conscious of the power our education holds. It is a power that can be wielded to uplift the marginalized, to give a voice to the voiceless, and to bring about lasting change. Let us never forget the responsibility that comes with this power, for it is through our actions that we can create a world where quality health care is not a privilege, but a fundamental right. Therefore, as we forge our way into the world as global health leaders, whether we find ourselves in research labs, hospitals, remote communities, or even busy urban centers, let us remember that the path to equitable health is not a solitary one. As UGHE has taught us, it requires collaboration, empathy, and an unwavering belief in our shared humanity to bring about real transformation. We must continue to learn from one another, appreciating the beauty in our differences and celebrating the strength that arises from our diversity. May we never lose sight of the lessons we have learned, the connections we have forged, and the immense privilege it is to hold an education that can shape lives and change destinies. Congratulations again to the MGHD class of 2023 on this huge milestone, and thank you all.
Thank you, Ruth, for a beautiful speech. Our next speaker, representing the gender and sexual reproductive health option, is Peace Iraguha. Peace Ndodi Iraguha is a passionate advocate for gender equity and sexual and reproductive health rights. As the co-founder of Lifespan Health, she strives to address health challenges through innovative approaches and strategic partnerships. Active in prominent health organizations such as Health Tech Hub and Novartis Foundation, Peace leverages her expertise to advance health equity. Currently an MGHD student in the GSRH track, her unwavering dedication to improving lives makes her a catalyst for positive change in the region. Peace, you're welcome.
Honorable Minister of Health, Dr. Sabe, and our commencement speaker, Dr. Joya, the UGHE Vice Chancellor, Dr. Joel, the Dean of Research, Dr. Abebe, the Dean of School of Medicine, Professor Abebe, and the Governor of the Northern Province, and the Mayor of Brea District, all protocols observed, good afternoon. How I wish Dr. Paul Farmer was here today to see these 46 flowers from his garden. Allow me to present to you the remarkable GSRH class of 2023, brilliant lawyers, I mean global health leaders. Though sometimes Dr. Tayeche's classes made us feel like we're becoming lawyers. Together, we've gone through history, guided by our beloved Blami, learning about how things were 40 years ago. We've shared countless lively debates and thought-provoking discussions in class, often becoming the last ones to go to the dining hall. We faced and survived occasional eye rolls from our non-GSRH peers whenever we raised the topic of gender equity. And as I stand before you today as the commencement speaker of the GSRH class, I want to express my heartfelt gratitude to my brothers, sisters, and Uncle Sam for trusting me with this tremendous responsibility. As I reflect upon the essence of our journey and the significance of this milestone, a simple yet profound message emerges. Let us depart from this place with our hearts and minds open, ready to embrace the world as lifelong learners. Let us step forward into our chosen paths, guided by humility and a genuine desire to understand and serve the communities we encounter. May we consciously choose not to be blinded by the privileges we possess. Above all, I wish for each of you to embrace love for yourself, so that we may extend love to others more fully. Talking about love, I want to talk about the imperative need for the role models who we know and love to propel gender equality within our communities. It is through these role models that young girls in their formative years witness the embodiment of feminist ideals, not as remote celestial beings, but as attainable figures present in our own families and communities. Allow me to express my deepest gratitude to Tion Johannes and Dr. Tayeche Moggs, who have served as my role models throughout this transformative journey. As the saying goes, I want to be you when I grow up. Their unwavering courage and boundless kindness epitomize the essence of the feminist we desperately need. My heart swells with pride today, for as we depart this esteemed institution, our communities gain individuals whom they can admire and aspire to emulate. It fills me with profound joy to envision my nieces growing up, looking up to me as they learn about the principles of gender equity, empowered by the knowledge that they too can forge a path towards a more equitable world. This signifies that as they grow, they will not succumb to the pressures of conforming to the societal expectations, molding themselves into likable versions instead of being their unapologetic self. To my beloved role models, I'm eternally grateful for instilling within me the courage to have uncomfortable conversations with my own family. We often find ourselves at odds, particularly regarding matters of LGBTQ communities, abortion laws, and gender equity. But together, let us continue to challenge harmful norms, advocate for inclusive policies, and ensure that every individual has the right to control their own reproductive health and make autonomous choices about their bodies. With Africa in our hearts and the lessons we've learned in this program, we have the power to make a lasting impact on the lives of countless individuals, transforming societies one step at a time. It is worth acknowledging that our program stands as a beacon of hope, the only gender, sexual, and reproductive health program in Africa. This demonstrates the commitment of addressing the unique challenge and opportunities that our continent presents. A special recognition is in order for the University of Global Health Equity for their tireless efforts in creating gender equity, with a commendable 60% admission specifically for women. Let us also extend our appreciation to the men in our cohort for their understanding, support, and active participation. We all recognize that true progress towards gender equality necessitates the collective efforts of all genders. As we work together to dismantle barriers and foster an environment where everyone can thrive, to the visiting faculty and UGHE partners, thank you for enriching this experience for us with your engagement. To the sponsors of this program, we are immensely grateful for your contribution in making this program accessible to us. Now I can't conclude without giving a big shout out to our amazing parents and support system. Despite their confusion about gender equity and its importance, I want to sincerely thank them for their unwavering support and going the extra mile to accommodate our passion pursuits. To the friends and family members whose patience we test every day with our radical feminist ideas, thank you for trying to understand and standing by us throughout this journey. As I bring my remarks to a close, allow me to extend my heartfelt congratulations once more to my esteemed fellow graduates. Each and every one of you fills me with immense pride, not only for the friendship we share, but for the remarkable global health leaders that you all are. My dear friends, the class of 2023, I implore you to embrace the power of showing up. Show up for yourselves unwaveringly each and every day, but more importantly, extend the same unwavering presence to those who find themselves lacking support. Venture into the often overlooked corners of our world and proudly stand beside those who face marginalization. Let our collective commitment to showing up be the catalyst for positive change and a statement to our dedication to creating a more inclusive and equitable society. May our paths be illuminated by light of kindness and compassion. Thank you.
Thank you, Peace, for a beautiful speech. Our last but not least student representative speaker from the health management option is Anthony Kwarbo. Anthony Kwarbo is a Liberian health professional with over 5 years of experience in the Liberian healthcare delivery sector. He has worked in the areas of procurement and supply chain management of pharmaceutical products at Partners in Health in Liberia. His passion is geared towards worldwide health improvement, with more emphasis on prevention against global disease burdens and reduction of inequalities among populations void of discrimination. While at UGHE, Anthony took up a leadership role as the representative of the health management track, a position which he took on with pride and grace. Welcome, Anthony.
All protocols observed. With a heart full of joy, I stand here today, grateful to highlight the shared experiences and memories created by every one of us throughout the MGHD 23 program. To look back at all the obstacles we have overcome to reach this moment in time. To focus on the potential impact that can transcend national boundaries that this class can make. and to emphasize on the interconnectedness, the bonds, and the network forged during the program and their significance for the future. And most importantly, to remind us all of the next steps. In order for us to take the next steps, we need to recognize and use our latest achievements, the acquired knowledge, skills, and networks that we gain at UGHE to re-image global health delivery and to acknowledge the upcoming milestones in our personal and professional lives. To re-emphasize the need for our collective involvement in re-imaging global health delivery, I would like to share this story called Everybody, Somebody, Nobody, and Anybody. You see, there was a very important job to be done, and everybody was asked to do it. Anybody could do it, but guess what? Nobody did it. Somebody got angry because it was everybody's job. Everybody thought anybody could do it, but nobody realized that everybody wouldn't do it. It ended up that everybody blamed somebody when nobody did what anybody could have done. You see, this is the core reality of the world. In essence, I say this to say that for the world to gain global health equity, we need to adopt a multi-sectoral approach. And as newly trained global health leaders, our next steps is to do something and do it now. We need to divorce this dependency syndrome and give more to those who need it the most. Otherwise, we become the nobody that did not do rather what needed to be done. Our beloved late Dr. Paul Farmer and his colleagues, not wanting to be that nobody, they did something that we are all beneficiaries of today, and we are proud of them. And then our late Dr. Paul Farmer once said, with rare expectations, all of your most important achievements on this planet come from working with others, all in the word partnership. This perfectly encapsulated a solution about giving more opportunities to those who need it the most and then doing something while working in team. On our beautiful Butaro campus, many a times when I was asked about the lessons I have learned in the MGHD program and how to apply them in the real world to remedy some of the global challenges that we currently face, my answer was always true partnership and multi-sectoral collaboration. I may sound biased, but it remains the reality. Thanks to Dr. Rex, the best team in UGHE, and his team, the health management team, because of you, during my time in the MGHD program, I gained invaluable lessons and skills that have profoundly shaped both my personal and professional development. One of the key lessons I believe we have all learned is the immense value of unity, diversity, and mutuality. Working alongside my classmates from diverse backgrounds and cultures exposed me to a wide range of perspectives, ideas, and approaches to addressing global health challenges. Embracing this diversity taught me the power of collaboration, empathy, and mutual respect in achieving meaningful change. I've learned how to appreciate the strength that comes from uniting individuals with different skills, experiences, expertise, and backgrounds towards a common goal, global health equity. I've also learned how to apply evidence-based and field-tested managerial functions in managing complex programs and organizations. These lessons have not only enhanced my ability to work effectively in teams, but have also deepened my understanding of the importance of inclusivity and collaboration in the field of global health. For this, I've come to say thank you to everyone who made the MGHD program possible. Thanks to God Almighty. Thanks to the late Dr. Paul Farmer for the passion of making UGHE a reality. Thanks to one PRH, especially PRH Liberia, for the continuous support. Thanks to all the donors that made it a duty for UGHE to function smoothly every day. We are grateful. To the land on the 1,000 hills, Rwanda, thank you. Thank you for opening your doors to us. Thank you for being hospitable. Thank you. We will never forget you. We'll always remember this beautiful country. To the faculty, all of you that had sleepless nights, that made it your duty to impart knowledge into us, we say thank you. To all the staff, the maintenance staff, the kitchen staff, enjoy your meal. Thank you for making us not to be hungry, not a day on UGHE campus. And thank you for making that campus beautiful every day and tidy. To the student services, hospitality team, transportation, security, all of you who made our stay in UGHE warfare, we say thank you. I say thank you to my late father for laying the foundation for me to be here today. And thanks to all my family and friends in this room and out of this room, in and out of this country. Those that are watching online, thank you for all your support. They were valuable to me. Thank you. Finally, to my colleagues, Iteri 23, Lions of Cohort 8, Amakulu. Today, the chorus of victory is being repeated. Today, we have double for all our troubles. Today, the echoes of success in this room whispers our year-long sacrifices. Today, our joy is a receipt of all that we have gone through. Today, and moving forward, I charge us to be successful by association. I charge us to rise by lifting others. I charge us to be one another's shoulders. PRH, our parent sponsor, they have this famous slogan that says, injustice has a kill. Today, as we leave the walls of UGHE, some of us will leave the land on 1,000 hills. But I want us to go out and make this world a better place than we found it. Lions of Cohort 8, go out and roar. I said, go out and roar as, as agents of social justice and bring pride to this den. I will end with this quote from the Bible that says, do not be weary in well-doing, for in due season you shall reap if you faint not. Never give up on your dreams. Maracuza Chini.
Thank you, Anthony, for that beautiful speech. And thank you to our 3 student representative speakers. Up next, we have a traditional dance performance by Inganji. Inganji in Kinyarwanda means to conquer, and it's a student-led traditional dance troupe that are passionate about promoting the Rwandan culture. Please join me in welcoming Inganji.
Abiwa abiwacu muraho abiwacu muraho abiwacu muraho. Zirabanae dukumbuye inka zaraye nahore warara nahore wararaye nanone nahore warara nahore wararaye nanone nagabinka zaraye zirarira n'inyana zazo nahore warara nahore wararaye nanone nahore warara nahore wararaye nanone nawararaye rugamba mugabo wananiye abagambanyi nahore warara nahore wararaye nanone nahore warara nahore wararaye nanone nahore ujya kuvuga inka ubanzi n'inyaya rwananga rw'indinyaya rwananga ninyurire mu ndenga n'abahizi nahore warara nahore wararaye nanone nahore warara nahore wararaye nanone nahore wararaye zirabira n'inyana zazo nahore warara nahore wararaye nanone nahore urugamba mugabo wananiye abagambanyi nahore warara nahore wararaye nanone nahore warara nahore wararaye nanone nahore kuvuga inka ubanzi n'inyaya rwananga w'indinyaya rwananga nahore wararaye n'abahizi nahore warara nahore wararaye nanone nahore warara nahore wararaye nanone nahinga zaraye zirabira n'inyana zazo nahore warara nahore wararaye nanone nahore warara nahore wararaye nanone nawararaye rugamba mugabo wananiye abagambanyi nahore warara nahore wararaye nanone 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 nahore zaraye zirabira n'inyana zazo nahore warara nahore wararaye nanone nahore warara nahore wararaye nanone nahore warara nahore wararaye nanone nahore rugamba mugabo wananiye abagambanyi nahore warara nahore wararaye nanone nahore warara nahore ikiribaza iri gitsinda nyamibwa ayibambi ikiribaza ire yanze guhora niyanga guhora tumuhonga mariza ayibambe niba yanze tumuhica ashaka erega sinyirya kandi sinyiryama ayibambe nzajya mu waruvusha yaje waruvusha uwo ni nyirizi nkondo ayibambe waruvusha ni mubyara wanjye namwiteguye iminsi itari mikeya ayibambe yaratambye kandi iratebuka nageze ibisage b'abatesi bacu ayibambe n'abagaragu bararirimba cyane ikiribaza ire narisukuye ayibambe nisukurana n'abasha banjye ikiribaza ire igitsinda nyamibwa ayibambe ikiribaza ire yanze guhora niyanga guhora tumuhonga mariza ayibambe niba yanze tumuhica ashaka babyeyi b'u Rwanda muhawe isango cyane mugwire babaye muri ba mutima b'urugo ye ni mugwire babaye muri aya majyambere namwe abareba cyane mugwire babaye mu muco w'u Rwanda nimwe gicumbi ye ni mugwire babaye muri abagore babereye u Rwanda cyane mugwire babaye ibibero byanyu byakikiye intwari zikondera zikondera Gwanga kugwa birarwa mugenga we yego baba yemwe nabo baba murumve muzana nyina umwami akenyera berwe we yego baba yemwe nabo baba murumve muzana Yeah. tarajake, yeah. Shani tarajake, yeah. Shani tarajake, yeah.
Thank you, Inganji. Thank you to our multi-talented medical students for such a remarkable performance. Our next order of events, I would like to invite Dr. Rex Wong, the director of the Bill and Joyce Cummings Institute of Global Health and the MGHD program director, to lead the ceremonial conferment of degrees. Dr. Rex.
All right. Honorable Minister of Health, our keynote speaker, Vice Chancellor, Dean of School of Medicine, Dean of Research, our Berea District dignitary, government representatives, partners, families, friends, staff, alumni, and students. We have 46 prospective graduates of the class of 2023, Master of Science in Global Health Delivery, 13 from the One Health, 19 from the Gender, Sexual, and Reproductive Health, and 14 from the Health Management Options. The graduation has been approved by the Academic Council, Academic Commission, as well as the Senate of the university. Before conferring the degree, I would like to invite our founding dean, Professor Abebe Bekele, to lead our pledge.
Thank you, Dr. Wong. Class of 2023, this UGHE declaration is a commitment to the highest standard of professionalism and ethical practice in your career as taught during your study here. It's a promise and a commitment that you, as graduates of the Masters of Science in Global Health Delivery, MGHD, will abide by the University of Global Health Equity's mission, vision, and values. We ask you and all our MGHD graduates to make this declaration publicly and enthusiastically in the presence of faculty, fellow graduates, family, and friends. Class of 2023, please rise. And repeat this pledge after me. I will be a global health professional who leads with intentionality, dignity, and integrity. I understand my responsibility and hold myself accountable to use this learning to contribute to the field of global health, especially to disadvantaged populations.
I understand my responsibility and hold myself accountable to use this learning to contribute to the field of global health, especially to disadvantaged populations.
I will maintain the utmost respect and compassion of human life, human rights, and human dignity.
I will maintain the utmost respect and compassion of human life, human rights, and human dignity.
I will deliver my services with equity and excellence.
I will deliver my services with equity and excellence.
I will promote and practice lifelong learning and research in global health. I made these promises solemnly, freely, and upon my honor. So help me God. Graduates, please be seated. At this juncture, I would like to acknowledge the presence of the Vice Chancellors, Chancellors and Deans of universities sister universities here in Rwanda. Thank you very much.
So I have the honor to present to you these candidates who have fulfilled the degree requirements mandated by the Higher Education Council of Rwanda. Students, I hereby confer upon you the degree of Master of Science of Global Health Delivery. I would like to invite our deans, Vice Chancellor, Honorable Minister, our keynote speaker to step forward on the stage to present our graduate the degrees. So here are the names of the graduates. Students from the Gender, Sexual, and Reproductive Health option, please rise. Elise Senjiyumva. Angel Guishaka Umbababasi. Numsemo Tembelichi Siaya Muche. Wangani Patricia Kawonga. Samuel God Habarurema. Evans Buchesia Kayati. Habikijeni Benjamin David. Sam M. Livingston. Lily Kesa. Besawit Wakanet. Ikram Hussein Ahmed. Bizimana Aklet. Elvis Benimana. Sarah Della Ripper. Elise Ihigwe. Sabimana Claude. Peace Iraguha. Students from the health management option, please rise. Prince Christian Ruingwa. Zakaria Degwa Muriruki. Jonas Hagos. Sean Alanik Muzansi. Ayuba Nuhutafa. Gabriel Elirio Lukwa Oke. Anthony C. Kwarbo. Jamilu Walamu Yanusa. Happy Gachiwada Jari. Tinsaye Abara Worku. Abeba Alika Kabade. Theodora Tess Coffee. Student from the One Health option, please rise. Valenzi Ruteyengwa. Piret Ngutete Mukungwa. Vivian Muhere Nyongkogru. Uwase Zihiga Ruth. Mohammed Tariq Ofardi. Guagasore Prince. Innocent Karikese. Abdurazak Ibrahim Garba. Elise Uwayo. Uwase Yimana Eric. Dukuzimana Marie Jose. Renee Gabu Songa. Thank you very much. Please be seated. So we have a few students conferring absentia. Michelle Lam, Beth Bogo, Anne Agoyi, Leah Masamo, and Momo Tagli. So please join us to congratulate our graduates of the Master of Science in Global Health, class of 2023.
celebrations. I want the world to know I'm happy as can be. I want the world to know I'm happy as can be. Congratulations and celebrations when I tell everyone that you're in love with me. Congratulations and jubilations. I want the world to know I'm happy as can be. Who would believe that?
Okay, congratulations. UGHE recognizes students who have outstanding academic performance. So every year we present the Best Academic Achievement Awards to the students achieving the highest grade point average. So I would like to invite our Honorable Minister of Health to present this award. Please step forward. And our deans, our vice chancellor, as well as our keynote speaker. So the highest academic achievement performers in the health management option is Theodora Tess Coffee. All right. So I would like to invite Dr. Shaka and Selmi to present the highest academic achievement in the One Health option.
The highest academic achievement performer in the One Health option is Uwase Zihiga Ruth.
And I would like to invite Sion Johannes Waka to present the highest academic achievement performer in the gender, sexual, reproductive health option.
The highest academic achievement performer in the JSRH option is, ready? Sara De La Ripa.
Thank you, everyone. Please be seated. Great. So thank you very much. Congratulations again. So now I'm going to invite our Vice Chancellor, Dr. Joel, to introduce our keynote speaker.
First of all, congratulations once again. It is my great pleasure and honor to introduce our extraordinary keynote speaker, Dr. Joya Mukeji, who has cordially agreed to share her wisdom, experiences, and insight with us on this important occasion. Dr. Joya is a physician, an educator, an activist trained in infectious disease, internal medicine, pediatrics, and public health. Since the year 2000, she has served as the Chief Medical Officer of Partners in Health. Dr. Joya supports Partners in Health efforts to provide high-quality, comprehensive health care to the poor in partnership with local communities and health officials across PIH 12 focus countries. She has served as an expert consultant for the World Health Organization and Ministry of Health on HIV, TB, health system strengthening, and health workforce development. Her focus is on human rights, HIV treatment, mental health, tuberculosis, Ebola, and human resource for health system, and health system strengthening. In 2014, Dr. Mukeji was one of the lead strategists in launching PIH efforts to fight Ebola and strengthen health systems in Sierra Leone and Liberia. What sets Dr. Mukeji apart is not only her extensive medical expertise, but also her deep understanding of the social, economic, and political determinants of health. Her dedication, resilience, and unwavering commitment to health equity serve as an inspiration to us all. When I met Dr. Joya Mukeji for the first time, it was on my very first day of work at Partners in Health, as she was visiting Kirehe district. And on that day, on a whole long day, we visited the patient in her home. We saw a couple of patients in the hospital. We trained nurses and doctors. And in our way to go and our way back, all in singing. And I wanted to highlight that Dr. Joya has the magic of bringing the power of joy and friendship that makes the patient's pain and the burden of the health workers lighter. Dr. Joya Mukeji, you're welcome.
Unlike the other speakers, I do need this. I'm a little short. All protocols observed, so that I can just say, what an amazing musical and dance performance. A big hand to our students and to Dean Abebe, Dean Tomlin, and Vice Chancellor Mubiligi. I think we may be doing our students a disservice in forcing them into medicine. They have great careers as entertainers. Honorable Minister of Health Nsanzimana, Vice Chancellor Mubiligi, Deans Bekele and Tomlin, UGHE faculty and graduates, esteemed people from Barrera District and the Ministry of Health, faculty, graduates, thank you for inviting me to address you on this beautiful, beautiful commencement day. I also want to extend our gratitude to the staff of the Rwandan Convention Center who have facilitated and set up this beautiful event. I want to start my remarks with profound appreciation for our faculty who have put their all into mentoring and teaching these graduates. Thank you so much. and to the staff of UGHE who have been mentioned multiple times by our graduates, who maintain the beauty of the campus while assuring that our students are cared for and nourished. And lastly, to my colleagues at Partners in Health and the Ministry of Health in Rwanda, who have now, for 20 years, built a transformative platform for equity in healthcare, one that is peerless in the world. Well, this is an occasion for your faculty to celebrate your accomplishments with you and your families. I must acknowledge and celebrate that our young university was this year ranked 8th on the African continent and 2nd in impact. So another round of applause for our amazing faculty who have weathered so much, from the pandemic to the untimely loss of our beloved founder and friend, Dr. Paul Farmer, to the growing pains of a young institution. You, our faculty, our deans, our vice chancellor, you have stewarded us through these storms. Today, the sun shines on you and all of our students. Thank you to the families and friends who stood behind these brilliant young people through their course of the master's degree program in global health delivery, in management, One Health, and sexual and reproductive health. Please give your families our great appreciation once more. It is a joyous occasion as you begin this journey. And in addition to celebrating and congratulating you, I want to thank you, our students, not only for studying with us at UGHE and sharing your experiences from more than 13 countries, but you students, now alumni of the University of Global Health Equity, you took a chance. You took a chance on joining our endeavor, on joining our university, now your university, which is new, less than a decade old. It is far away in the remote but beautiful province, northern province, in the cold Barera district. And our university has a weird name, Global Health Equity. These are not words that appear in university names around the world. Universities are named after people, like Harvard and Sorbonne, or cities like Oxford and Stellenbosch. Rather, our university, your university, is named after and founded upon an idea, a vision, global health equity. We know, yes, we know that when you took your chance with us in Butaro, at our new university, that in some way you believed in this idea and this vision. So today on your commencement, in the beginning of your new postmaster's life as a UGHE grad, as a proud lion, I want to share a few words with you about the idea, the vision of global health equity. What is global health? What is equity? And from whose perspective do we do this work? What are the stories, the data, the studies and systems that will bring about equity and justice in health in our time and around the world? So I'll start with the question, who tells the story? The great writer Chinua Achebe cited an African proverb when interviewed about why he wrote his famous novel, Things Fall Apart. Chinua Achebe said, "Until the lions have their own historians, the history of the hunt will always glorify the hunter." Remember, my friends, you are lions. You are UGHE Lions, and we are here in Rwanda, on the continent of Africa, to tell the story, to change the narrative, to flip the script about who writes history and who shapes the future. The future of this country, the future of your country, and indeed the future of health in our increasingly globalized and inequitable world. The history of health through the 19th and 20th century was not written by lions. Rather, those who were the hunters, the extractors, the colonizers, the hoarders of wealth decided that modern medical care was too expensive and too complicated to be afforded to the people of this continent. In fact, narratives of prevention, not treatment, information and education, not strategies to address ill health or poverty, were promoted as the only feasible option for the poor anywhere, from the US to Burkina Faso, from Guatemala to Nepal. Instead, health programs often created in the gleaming halls of academia in the global north, the US, Europe, all but forbade the treatment of the sick. Make no mistake, the idea of prevention only and not cure did not emanate from the African people themselves. Rather, it emanated from a Euro-American gaze that judged poor people's ignorance rather than their impoverishments as the architect of human misery. This perversion of the truth reasoned that good health of the wealthy, the powerful, yes, the hunters, was due to their cleverness, their superior intelligence, rather than the privilege and fortune amassed through the pillage of this continent and others. When I was getting my master's degree many decades ago, I was taught that community members should simply dig latrines, wash their hands, learn about diseases, even as treatment was well known in my home country for AIDS, for orthopedic trauma, for diabetes, and the like. As I ventured into my own work as a doctor and a Harvard professor in Kenya, in Uganda, then in Haiti and Peru, and in poor communities in the US, my proximity to patients and to those who suffered the ravages of poverty and ill health, the ravages that were consequences of the historic and present-day violence of the hunter, taught me the greatest lessons that I have ever learned. I learned that people are wise and brave. Every day as they raise up against the daily violence of oppression and poverty, they farm, they feed their children, they fetch water, they laugh, they love, they sing, dance, weep, give birth, and bury their dead. And to a person, my patients understood the cause of their suffering, the trap of their impoverishment. I learned from Shushu, a teenager in Haiti with severe malaria, that a bed net did not help her because she needed to study for her exams until very late. And not having electricity in her home meant that she sat outside a water vendor and tried to do her studies. I learned from Jennifer in Uganda that exchanging sex for school fees was her only option to complete her education. And yet once Jennifer and Shushu were sick, they needed care, they needed the fruits of science, not more prevention talks. And I also learned that they had ideas, they had a vision, they had dreams, and they wanted to be part of the solution. The lions wanted to tell their own stories, wanted me to see and feel their worth as humans deserving the same care that myself and my family could get. with our American passports, our privilege, and our white skin. They taught me that global health is a human right, not a privilege connected to our social class or country in which we were born. They and so many patients and community members taught me that achieving equity required resources to address the material burden of poverty that makes people sick, from a lack of electricity to school fees to food insecurity, and that we needed health systems and care for the sick. You are truly a global group. You know many of these stories from more than 13 countries, from Rwanda to Liberia, from the US to Syria. You have been exposed to the realities of unjust systems from your backgrounds in medicine, in nursing, in pharmacy, and management, from advocacy to environmental science. We, as your faculty and now your colleagues, have seen you grow in your ability to think critically about health equity, about how we all must do better. Whether you studied the rights of sexual minorities or the impact of volcanic soil on peasant farmers, whether you designed and measured programs to decrease death in childbirth or improve access to family planning, you did so through an equity lens. We encouraged you, and we will continue to encourage and even insist that you continue to learn lessons from the most affected. As you learn, as you listen, as you accompany people that are suffering, you will work together, lion, to rewrite the stories. As Chief Medical Officer of Partners in Health, I first set foot in this beautiful country with my beloved friend, Dr. Paul Farmer, 20 years ago. Our little-known organization at that time, Partners in Health, was invited by the government of Rwanda under His Excellency President Paul Kagame because PIH had taken the bold move of actually treating people who were living with HIV. We gave them the cocktail of AIDS drugs, along with community health workers, people living themselves with AIDS, Haitian doctors and nurses. And based on this small, significant work, the government of Rwanda took a chance on us. Even though many around the world was saying that AIDS treatment was not feasible, it was not possible, people in Africa couldn't tell time, we said that is not the story written by the lions. Many brilliant Rwandan doctors, nurses, and community health workers have led and championed these efforts, and as PIH, we are greatly honored to have been a small part of the internationally renowned success of Rwanda. Honorable Minister Nsanzimana, thank you so much for welcoming us in this country and to be part of your team. Here in Rwanda, my Haitian colleagues and I shared what we learned from Haitian communities we served, and in turn, we learned so much from the strong communities that existed in Rwanda, from the unwavering support of the government of Rwanda for the goal of health equity. And while as PIH and in my role as a faculty member at Harvard, we promoted the vision of global health equity in Rwanda and Malawi, Peru, the United States, Kazakhstan, and Lesotho, it was here in Rwanda, due to the commitment of the Rwandan government and the brilliance of the Rwandan people, that the idea of turning this visionary work of delivery into a university education took root. Led by community engagement and leadership supporting compassionate case finding and follow-up, which we call accompaniment, led by the government of Rwanda, investing in staff, supplies, infrastructure, and systems, which we call health systems strengthening, the breathtaking success in Rwanda stood as a stark contrast to the narrow and vertical prevention programs of the past. It was on these principles, on the roaring of the lions, on accompaniment with and for communities, on strong government and public institutions, that the vision of UGHE was born. A university that could study, could hone, could shape and spread these principles of global health equity. Partners in Health was always an academic NGO, rooted in community knowledge and wisdom, supporting governments in their efforts to realize health. And because our late founder, the great Dr. Paul Farmer, was a Harvard Medical School professor, as am I, as are many of my colleagues around the world, we were able to leverage from those early days in Haiti the clinical delivery work with scholarship. Scholarship like published papers, protocols, textbooks about delivering care, strengthening health systems, treating other diseases, building a health workforce. We published articles, authored textbooks, drafted national guidelines with our partners around the world. Community members often participated actively in research, advocacy, and international conferences. And it was this linkage between the delivery of care to the most vulnerable and achieving health equity that we sought to create in the form of a university. Many years before the founding of the University of Global Health Equity, Dr. Jim Kim, a co-founder of Partners in Health and now the University of Global Health Equity's Chancellor, called PIH the crucible of creativity. The place, he explained, where our efforts in the delivery of care to the most vulnerable could be forged into rigorous academic work that would change the world. However, I, as an academic, as a professor at Harvard Medical School and the director of the master's program in global health delivery there at Harvard, I am not now, nor have I ever been, a dispassionate or objective observer to suffering. Rather, my research, your research, our research must be guided by the conviction that high-quality healthcare must be delivered, even in the most challenging circumstances. Our research questions are not if. Our research questions are how. How do we achieve equitable outcomes? How do we deliver care when systems are weak and strengthen them? How do we engage community members in their own care and healing? How do we use funds to strengthen the system, measure the impact on programs from child nutrition to mental health to surgery to cancer care? And that is where you join in this movement for equity, in this story, the how to deliver care, to achieve equity and manage, not for the sake of a donor report but for the betterment of the health of your people. How to interface between humans, animals, and the environment. How to mitigate the forces of gender inequity so that health can be equitable between all genders. We know your future will be bright. We believe it will be impactful. You will make your university, your alma mater proud as you compare your conviction for health and human rights with hard-bitten academic scholarship. Scholarship that demonstrates that health equity is possible if the barriers to care are addressed. Global health for all, everywhere. That is it, the University of Global Health Equity. In my 3 decades at Harvard and my work in multiple countries around the world, including 2 decades right here in Rwanda, I know of no other university with this simple yet lofty goal. As you commence today, we welcome you, Lions, to rewrite history, to shape the future of health from who tells the stories, to who does the research, to how we fight for a better world. People often ask me, as Chief Medical Officer of Partners in Health, as a faculty member at Harvard and at UGHE, if I work for an NGO or an academic institution. My answer is always the same: yes. I work for an NGO that believes that health is a human right and that it is attainable. I work for an academic organization that believes, teaches, and studies how to achieve global health equity. And I would add, I work for the patients who are our bosses in a social movement for justice around the world. We are lions. You are lions. You will rewrite the script and champion equity in global health and craft a new narrative for a bright and more equitable and just future. Again, I offer my deep congratulations on your accomplishment of attaining your master's in global health delivery, in management, in gender, sexual, and reproductive health, in One Health. And my gratitude, I offer my deep gratitude to all of you for joining this movement, for believing in this journey, so that the lions can be writers of their own history and architects of a brighter future. Thank you and congratulations.
Thank you, Dr. Joya, for the wonderful speech. I would now like to invite our Vice Chancellor, Dr. Joël Mubiligi, to introduce our guest of honor.
Thank you very much, Dr. Joya, for this powerful and inspiring speech. It is now my honor to introduce our esteemed guests of honor, Minister of Health, Dr. Sabin Nsanzimana, who has graciously agreed to deliver remarks at this momentous graduation ceremony. Dr. Sabin Nsanzimana is the Minister of Health of Rwanda. He previously served as Director General of the University Teaching Hospital of Butare. Prior to that, he led the Rwanda Biomedical Center from 2019 to 2022. After 10 years serving as Director of the National HIV and Hepatitis Program. He holds extensive experience in infectious disease and non-communicable disease programs design, strategic planning, and implementation science. Dr. Sabin holds a medical degree and master degree in clinical epidemiology from the University of Rwanda and a PhD in epidemiology from the University of Basel in Switzerland. Dr. Sabin served as principal investigator for several large research projects, including clinical trials in Rwanda and in multiple countries collaboration. He is a fellow of the Royal College of Physicians of Edinburgh and African Scientific Institute. He serves as our adjunct assistant professor of global health delivery at the University of Global Health Equity and teaches clinical epidemiology and research methodology at the University of Rwanda. Throughout his esteemed career, Honorary Minister Dr. Sabin Nsanzimana demonstrated an unwavering commitment to the well-being of our society. Ladies and gentlemen, please join me in giving a warm round of applause as we welcome the Minister of Health on the stage.
Good afternoon. Muraho neza. Thank you, VC Joel, for the very generous introduction. Dr. Joy, I haven't seen you for some time. It was a pleasure to see you again today. Dean Abebe, Dean Tom, many faculty members, alumni, And more importantly, the class of 2023 of UGHE, 13 countries, 46 students, health management, gender, sexual reproductive health, One Health. It's a very productive day in Rwanda. So congratulations also to families, members, staff of UGHE, colleagues, friends, everyone who came to this beautiful day. Once again, welcome. It's my pleasure. It's actually my first time to deliver a speech in this kind of uniform. It's a history in my life. I'm very happy to be here. I've made a brief speech, but I would prefer to make it very natural, and so I speak from my heart. Let me just mention a few things. So this program has started a few years back, and I was lucky to be there before it starts. And I remember the first short courses we were having in Iraguha, around a table under a tree. I was actually wearing a red T-shirt with Joyce, and that happened to be the first publications on this program to be. That time was mentioned as something to be created in the future. I'm sure Joel was there. A few members of UGHE current UGHE were there, as we see something happening, developing. So I'm always happy to see that, coming back and see this university already growing and contributing to not only to Rwanda's healthcare system and sector, but also beyond, and beyond our continent. So that is something really I'm happy to see, and I hope it continues. And UGHE, the lions, as you say, continue to write their own stories. And please do, lions. No? All right. So I want to highlight something very important. We've had discussions recently about these inequities that we're observing across the world, across the globe, as far as health systems are concerned. There's only one doctor, one midwife, and one nurse, all combined. It's a ratio per 1,000 people. In Rwanda, the same in Africa and other resource-limited countries. It's a ratio of 1 per 1,000. So World Health Organizations suggest that we should have minimum 4 per 1,000 people to treat, to care. If you look at countries that have made advances in care, like the examples that Dr. Joy was mentioning, they are more than 25 per 1,000 ratio, provider to people to be treated. But here we are talking about 1 per 1,000. What does it mean? It means the care we are delivering will not reach everyone, or will reach the few who are lucky. Even those who are delivering the care service will not be able to sustain that demand, because you can't be 4 people. You can do your best, but you can't do 4, 5, 10 people. So from there, we made our own estimations here in Rwanda. How long will it take for us to attain 4 providers per 1,000 people, which is the minimum for a healthcare system to sustain? If nothing is changing drastically today, it is going to take us 185 years to reach that minimum ratio. That is the case for Rwanda, for Africa, for all resource-limited countries. 185 years. Our grandchildren will not see it. because even disease will continue to grow and increase. The pressure, what you mentioned today, outbreaks, pandemics, climate change, all the different pressure that actually create diseases will continue to emerge. But our capacity to deal with those problems, at least 185 years. That is true statistics. What are we doing about it? UGHE has been doing great contributions, but 46 people, for the needs that we have, it's like a drop into the ocean. It's a drop into the ocean. I'm not discouraging you that you can't change these things, but what are you going to change most is to understand the gap, the needs, the pressure, the demand that is out there. So you don't work as one-on-one, or as business as usual. You have to work in a very special circumstances that you're changing the history of 185 years into something that can be dealt into maybe something you want to see in your lifetime, that your children want to see, that your grandchildren want to see. So from there, we developed a strategy that I'm glad UGHE was part of it, which recently was put out. Now we're starting active implementation, that we are going to quadruple our current healthcare workforce. Quadruple, 4 times. From 1 to 4. But there's another factor. How long? For how long we are going to do that? Will it take 105 years? Because that is also quadrupling that number in the time, bringing it the shortest time possible. So we put it into a period of, guess what? 4 years. 4 years on average, because this is the minimum time, using our energy, our efforts, our creativity, the things we've done that seemed impossible. This is Rwanda. Rwanda can do it, and if we can do it, we can demonstrate that others can also do it. Because we don't have such huge economy that is going to bring things at a go. But what is important is not the money. It's the idea, the commitment, the enthusiasm to go, and the unity, the teamwork that we're going to make it happen. So that became our 4x4 strategy. Quadruple our current healthcare workforce in 4 years. So we have started this year. We have started. We are already seeing 4 times coming up. Every single enrollment, all programs, all initiatives that we are doing in trainings, capacity building, must go in line with 4x4, because we can't afford to wait 185 years. Do you want to wait? We can't wait. We can't wait. This is another piece of history that I'm glad to be here today to mention it in this special moment of UGHE, because this is about human rights, it's about social justice, it's about doing what is right and doing things differently and things that are not easy. Because if it was easy, it could have been done before. And because it's not easy, we are not going to delegate it to our grandchildren. And if we don't do it right now and make a big change, a big move, that we train the people we need, numbers we need, because the disease are waiting out there, people are dying out there because we are very few as healthcare providers. Very few. So waiting is actually, I got to discover in the Bible, forgot the verse and the number, is also a sin. Knowing what to do and not doing it is a sin. It's not right. So if you believe in God, at least be convinced that is in the Bible. If you don't, at least look around you in Butaro, in Wimwavu, in Kirehe. You will see people who are in need of more of you. They need more of you. So do we complain and blame the Ministry of Health? Or blame Joel? Or Professor Abebe? Or Joya? Who do we blame? No one. We have to make these changes ourselves. Don't be part of those people who are complaining and blaming. Just do your part and believe that it's beyond you. It's beyond your degree, your master's program. You can have many degrees, but having degrees doesn't mean you're going to change or make an impact on people's lives. It's different. People who haven't gone even these masters, who haven't sit in this room, are making big impact in their communities. These degrees, it's another support to you that actually we trust you, you're going out there and make the changes, even if it seems impossible in your community, in your neighborhood, in your country, in your village, in your school, in your office. If it seemed impossible for you to make a change, just demonstrate that change is possible, and I'm going to do it. And do it. The smaller things, the smaller positive changes we put together at the end make a big change. We've seen it here, 20 years and more. People dying from AIDS, TB, malaria. Today, we're discussing with medical doctors that they haven't seen any Kaposi case for the last 5 years. Kaposi. Maybe the young ones here may not even know what Kaposi is. These are the cases we're dealing with just a few years back. But they're becoming history, and 4 times average number of health workers, providers we need must be made a history in a few years to come, because today we are going to start. Actually, should have started yesterday. So if we lost yesterday, it means we have to run many times faster today. So we have no doubt that this program that you just completed today provided you with necessary skills, knowledge, innovative thinking, critical thinking. But beyond papers, beyond computers, what comes from your heart? The person you meet out there when there's no ceremony, when there's no camera. The person you talk to because she doesn't have money to go to Kigali. She or he is in Butaro. And what you do to that person is more important than all skills you've learned. Speak from your heart, walk from your heart, wherever you go. Our healthcare system needs you. Rwanda needs you. We need more innovation. Maybe the next new vaccine or the next new digital program that's going to change lives of people. Artificial intelligence. The better ChatGPT thing is coming from you that will change people's lives. Maybe someone sitting in this room has that formula. Believe that you are the one. It doesn't have to come from very far. But in everything you do, please prioritize equity, inclusion, accessibility. Your journey are going to be different. Some will succeed, others will try, others will probably not. But even if something stops you doing well, wake up in the morning and say, let me try this time and do something better than yesterday. You are naturally empowered to do good things as human beings. Sometimes environment, One Health principle, not disease-wise, The environment, the context, the situations, the stress, the pressure may direct us differently. But always think about, what did I learn at University of Global Health Equity that I have to apply and come back to my core principle? Whatever happens, think about it. I have a few points to highlight. I was given 10 minutes. I'm trying to save a few. But to succeed professionally in life, most of you are already somewhere working. Others are going to start working. We are very happy to have you at Ministry of Health. But in everything you do, you must apply one thing that is universally proven to work: discipline. Discipline is the foundation of everything. Please, avoid what is easy, because there are so many people who are fighting for it, because it's easy. Avoid shortcuts, because everyone wants to take the shortcut. Don't give up, because things will not go in a straight line. It's very rare that a big plan, a big idea, goes straight line. It always goes up and down, left and right, sometimes down and up, left and right. But keep a direction that if you don't give up, it means you will fail. And the more you fail, combined plus lessons equals success. This is another universal formula. I don't know why Einstein forgot about this one. Always have dreams, like 4x4 or something else, a dream you have in you. Those dreams are plans, ideas, but if you apply the hunger to achieve the dreams. You have a dream, you have hunger, you don't stop, you continue. That is how you're going to make an impact. Otherwise, take shortcuts, take the easy things, then it will be easy for a few days, but it will not be good for a long time. You're living longer. There are many people who are waiting for your contribution. Be the people of value and impact. As I said, never complain. Instead, create solutions and fix problems. The more time you spend fixing problems, the more actually innovations you find on your way. Never complain. Find solutions to your problems. As I mentioned to you the time I visited in Butaro, I recognized some faces. Train until, forgot it. Train until you can't get it wrong. Train until you can't get it wrong. It means that studying, learning never ends. It's a process, it continues. It's like drinking, it's like eating, like living. So please, your studies are not done. I'm sure your professors may say it better, but since I happen to be part of the faculty, I have the right to mention it as well, that you must continue, learn, read, experience, discover, even do better than what you've learned at University of Global Health Equity. More importantly, take care of yourselves. Your body, take care of yourselves. Your body, your mental health, your brain, your thinking, your environment, your houses, your family, friends. Please make it a priority, because that is the source of all energy and creativity you're going to bring out there. If you're not well taking care of yourselves, you can't take care of someone else. We need you healthy, creative, happier, and so on and so forth. There's no better investment than yourself, than you. There's no spare part that's going to replace the main of you. You're going to live at least 50 years ahead, or maybe 100 years ahead. So if you have 100 years to live, start now. Take care of yourselves. Eat well. Drink less. I was already hearing less, something. Let me say it myself. So that is very, very important. If you are a healthcare provider, start by caring your own health. And if you do, someone else will see it and apply it. And because you're a person of value and you bring value and impact the community, start with yourself, with the people around you. Allow me to end with a quote from our beloved Dr. Paul Farmer. I'm sure some of you may have heard about it. It says, with rare exceptions, all of your most important achievements on this planet will come from working with others. Or in a word, partnership. I want to add something my other friend who was at my PhD committee kept repeating to me, that Saba, good partnership, it's all about great friendship. So, partnership and friendship. The class of 2023, they're going to go out there, make changes, impact, big changes, not small ones, not easy ones. Make good partnership, but also make good friendships, because we benefit from that. Again, accept my heartfelt congratulations for your outstanding achievements. Once again today, it's not the end. I have more to do, more studies, more discoveries. Thank you very much for your kind attention and for the time we spent together. Munsi mwiza.
Thank you so much, Honorable Minister Dr. Saban, for the wise words. MGHD class of 2023, congratulations. We have now come to the end of this graduation, but it is not the end of the celebrations. I look forward to seeing each of you make a mark in the field of global health, and I know the future of global health is in capable hands. I would like to express my gratitude to our guests of honor, our commencement speaker, the Vice Chancellor, ministers, our distinguished guests, parents, friends, family, UGHE alumni, and everyone who has tuned in, whether in person or online. Thank you for being with us today. So we are about to start our recessional, so please rise, everyone, as our graduates, our guests of honor, and our faculty exit the room. In the meantime, the Inganji dance troupe, please get ready for your final performance. Graduates, followed by the faculty sitting behind you, please exit the room. Our guests of honor and our faculty on the floor, please follow. To our guests, family, and friends that are still in the room, please remain for a few seconds as we see our final performance and to give our students time to take pictures with the faculty.
Kandarugari twatashye muri gakondo ngo dutanga umusanzu we wo kubaka u Rwanda. Rwanda we, Rwanda rugari twatashye muri gakondo ngo dutanga umusanzu we wo kubaka u Rwanda. Rwanda we, Rwanda rugari twatashye muri gakondo ngo dutanga umusanzu we wo kubaka u Rwanda. Rwanda rwa Gasabo wuguruye amarembo we, shenge ruragendwa. Rwanda we, Rwanda rugari twatashye muri gakondo ngo dutanga umusanzu we wo kubaka u Rwanda. Rwanda we, Rwanda rugari twatashye muri gakondo ngo dutanga umusanzu we wo kubaka u Rwanda. Rwanda we, Rwanda rugari twatashye muri gakondo ngo dutanga umusanzu we wo kubaka u Rwanda. Twaje tujya inama tugena
Inganji. To our guests, please join us for light refreshments right outside of this hall. Inganji, please feel free to continue.